Well, every winter, nearly 20% of the country's population is impacted by the influenza virus. Well, this year, health officials say there's a concern for a twin pandemic during COVID-19. KSBY News reporter Cindy Brandt shares advice from doctors on what precautions to take for the upcoming flu season.
Every year, doctors say the best way to prevent the flu is by getting the vaccination. But as COVID-19 is still among us, an infection specialist here at Sierra Vista Regional Medical Center tells me that the recommendation to get the flu shot is even greater this year.
Anytime you feel like the scratchy throat or anything, it's like, oh my gosh, is it a cold or is it something worse?
Flu season is almost here, and the COVID-19 pandemic isn't over. Public health officials entering new territory this fall, balancing both viruses.
As we approach the fall, there is great concern for what some are calling a twin pandemic, COVID and the flu.
One of the biggest challenges is many patients with COVID-19 show flu-like symptoms.
Coughing, shortness of breath, fever. So in a normal flu season, if you get those symptoms, you can probably assume you have the flu or a cold. This year you will be concerned if you have COVID.
Ecker says fewer flights could help with the flu strains that are carried internationally, on top of people taking extra everyday precautions.
We'll definitely see a fair amount of flu infections, hopefully less because of the hand hygiene and mask wearing that we've been doing.
While the spread of both viruses is similar, Ecker says flu tends to be big wet droplets that, when you sneeze, fall to the ground and don't spread as far as droplets from COVID. Flu activity typically begins in October, but several pharmacies along the Central Coast have been offering the flu shot for several weeks.
I haven't yet, but I will be getting a flu shot this year.
According to the CDC, flu activity peaks between December and February, but it can last through May. And while a vaccine for COVID-19 is still in the works, doctors say the flu vaccine could be more important this year.
There's hope that maybe the flu vaccine actually helps with COVID infection.
Protection from the flu shot does decline over time, lasting on average for about 6 months. The infection specialist here at Sierra Vista recommends that you get the flu shot earlier rather than later this year, as it can take up to 2 weeks for antibodies to start kicking in after you have the vaccine. Reporting in San Luis Obispo, Cindy Brandt, KSBY News.
The infection specialist says there is no evidence so far that the flu vaccine could increase your risk of getting COVID-19 or worsen symptoms.